Imagine, for a second, a parallel circulatory system in your body, like hundreds of thousands of miles of complex vessels.
Right, a massive network.
Exactly. And it dictates the entire orchestration of your immune system. Plus, it acts as the exclusive sanitation department for your body's most toxic cellular waste.
It's essentially what keeps you alive on a microscopic level.
Yeah, but here's the crazy part. Now imagine that for the better part of modern medical history, surgeons and researchers entirely ignored it.
Oh, absolutely. It was just viewed as mere biological plumbing. I mean, they called it the Cinderella of medicine.
The Cinderella of medicine. Wow.
Yeah, completely sidelined. All the arterial and venous systems got all the clinical attention, the funding, the textbooks, and this vital network was just left in the dark.
Which seems completely absurd now, considering we are dealing with an incredibly sophisticated, pressure-driven transport network.
Truly absurd.
Mm.
But thankfully, things are changing.
Right. And we are decoding that exact system today. We're doing a deep dive into the lymphatic system with a very specific mission. We are translating cutting-edge lymphatic science into a proactive daily roadmap.
A roadmap for managing secondary lymphedema, right?
Yeah.
Specifically following breast cancer surgery.
Exactly. If you have been handed this diagnosis or, if you were navigating those really frustrating early warning signs, we know that transition from clinical shock to long-term wellness can feel incredibly isolating.
It's a very lonely, scary place to be for a lot of patients.
So we are pulling from a massive stack of literature to bridge that gap for you.
And I have to say, the clinical data we have now is just staggering compared to even 20 years ago.
It really is. So for this deep dive, we are looking at advanced pathophysiological research from a 2024 textbook on lymphatic targeting.
Maybe clinical stuff, yeah.
Super dense. We're also tearing apart a rigorous Swedish SBU alert report. That one evaluates the actual medical evidence behind lymphedema treatments like compression and manual drainage.
Which is crucial because there's a lot of misunderstanding about what actually works.
Right. Then we are integrating Dr. Gerald Lamol's foundational work, Lymph and Longevity. He frames this whole system on a cellular epigenetic level.
His work is brilliant for patient empowerment.
I totally agree. And we are even bringing in Donna Eden's energy medicine protocols on physical lymphatic flushing. We want to see how everyday mechanical movements align with all this advanced biology.
What becomes immediately clear across all these sources, from the highly clinical to the holistic, is that the historical ignorance regarding the lymphatic system wasn't necessarily born of negligence.
It wasn't just doctors not caring.
No, not at all. It was a technological limitation. The lymphatic fluid is essentially clear, right?
Oh, so you couldn't see it.
Exactly. The vessels are translucent and microscopic. When a cardiothoracic surgeon opened up a chest cavity in the past, they saw the bright red pulsing arterial system. They saw the dark blue venous return.
The obvious stuff.
Right. But the lymphatic system, it was practically invisible to the naked eye.
Okay, let's unpack this. If this system is essentially our body's maintenance and security department rolled into one, why are we only just now realizing its importance? What changed?
Technology changed. Advanced molecular imaging and cellular mapping.
Like new microscopes?
Kind of, but much more advanced. Initiatives like the HubMap Consortium are mapping human tissues at the single-cell level.
Wow.
Yeah. And we now have fluorescent lymphangiography. That's where we can inject specialized dyes and literally watch the lymphatic fluid pump in real time.
So we can finally see the invisible system in action.
Exactly. Clinicians can finally appreciate the sheer magnitude of what this system does. I mean, it dictates fluid homeostasis, it regulates systemic inflammation, and it serves as the primary battleground for our immune defenses.
So before we get into how surgical interventions like axillary node dissections for breast cancer disrupt this system, we have to understand the mechanics of the healthy state.
We have to know how the river flows before we talk about damming it up.
Right. And Dr. Lamol refers to the body as a walking aquarium, which I think really shifts the perspective.
It's a great analogy.
It is. We are basically made of cells suspended in fluid, and that fluid has to be in constant motion. But here's the architectural problem I ran into while reading the sources.
Oh, look at that.
The cardiovascular system has a massive muscular pump, the heart. It pushes the blood out. But the lymphatic system has no central pump at all.
None. Zero.
So how does this fluid actually move, and what exactly is it moving in the first place?
To understand that, we need to look at the microcirculation level, specifically the capillary beds.
Okay, take me there.
So as your heart pumps blood through the arteries and down into the microscopic blood capillaries, there is a physical force called hydrostatic pressure.
Like water pressure in a hose.
Exactly. And that pressure forces fluid, oxygen, and nutrients out through the capillary walls to bathe your cells. That fluid sitting in the tissue spaces is called interstitial fluid.
And the blood-venous system pulls most of that back in, right? Through oncotic pressure, I think it was called.
You nailed it. Almost all of it gets pulled back. About 85 to 90% of that fluid is reabsorbed by the venous capillaries.
Okay, so that leaves 10 to 15% behind.
Yes. The veins cannot absorb everything. They leave behind that 10 to 15% of fluid in the tissue spaces. And crucially, it isn't just water.
Right, the sources mentioned it's kind of nasty stuff.
It is a highly toxic, protein-rich sludge. It contains cellular debris, oxidized lipids, massive inflammatory proteins, and dead cells.
Why can't the veins just take that out, too?
Because these macromolecules are physically too large to pass back through the tight junctions of the venous capillary walls. They just weren't fit.
Oh, I see.
And if they are left in the tissue, they will literally kill the surrounding cells. They are toxic.
So the lymphatic system is the only exit route for the body's heavy-duty trash.
The absolute only route. The initial lymphatic capillaries are structured entirely differently than blood vessels. They have a single layer of overlapping endothelial cells.
Meaning they aren't sealed tight.
Right. They don't have tight seams. They overlap like shingles on a roof, acting as microscopic swinging doors.
Swinging doors. Okay, I can picture that.
Furthermore, these cells are attached to the surrounding tissue by tiny collagen fibers. These are called anchoring filaments.
Wait, let me visualize this. If there is no heart to suck the fluid in, do these anchoring filaments physically pull the doors open when the tissue swells?
That is the exact mechanism. You got it.
That's wild.
It is. When the interstitial fluid builds up and the tissue begins to swell, it physically pulls on those anchoring filaments. The filaments yank the overlapping endothelial doors open, and the pressure gradient forces the toxic, protein-rich fluid into the lymphatic capillary.
Wow. And the moment it crosses that threshold, it's officially called lymph, right?
Exactly. Before that, it's interstitial fluid. Now it's lymph.
Okay, so that handles getting the fluid into the pipe, but it still has to travel all the way up the arm against gravity into the chest.
And this is where lymph propulsion comes in.
How does that work without a heart?
Well, once the fluid moves from the initial capillaries into the larger collecting vessels, the architecture changes. These larger vessels are divided into segments called lymphangins.
Lymphangins, okay.
Each lymphangin acts as its own tiny, primitive heart. They possess a layer of smooth muscle that intrinsically contracts, and they are separated by one-way bicuspid valves.
So they can't flow backward.
Right. When a lymphangin fills with fluid, the smooth muscle stretches, triggers a contraction, and squirts the fluid through the valve into the next segment.
So it's essentially an endless chain of microscopic pumps pushing the fluid upward?
Exactly. But it also relies heavily on what we do externally.
Wait, what do you mean externally? Like our movements?
Heavily.
Yeah.
Because the intrinsic pumping of the lymphangins is actually relatively weak. It requires systemic external forces to achieve adequate flow.
Oh, so we have to help it along.
Right. Every time you contract a skeletal muscle, like when you walk, or even just move your arm, that muscle bellies out and physically crushes the adjacent lymphatic vessels.
Like squeezing a tube of toothpaste.
Perfect analogy. It forces the fluid upward through the one-way valves. Arterial pulsation next to the vessels does the same thing. Even the paracelsus of your digestive tract is constantly massaging your deep abdominal lymphatic trunks.
Okay, so we have a pressure-driven, muscularly assisted sanitation system, but it's also the immune system's primary transport network, right?
Oh, it's critical for immunity.
When the expert sources talk about macrophages and antigens traveling through this fluid, I keep picturing a 19th century train depot.
I like where this is going.
If the lymph fluid is the train, it's carrying enemy intelligence like a piece of a virus down the tracks. And the lymph nodes are these heavily fortified stations waiting to receive that intelligence.
That synthesis perfectly illustrates the adaptive immune response. The lymph nodes are highly organized biological forts.
What happens when the train arrives at the fort?
When the lymphatic fluid enters a node, it slows down drastically. It percolates through a maze of sinuses. This allows the resident macrophages, the large phagocytic cells, to physically engulf and destroy debris and pathogens.
So they are the frontline soldiers stationed at the depot.
Precisely. Meanwhile, dendritic cells, which have captured pieces of the invading pathogen out in the tissue, use this fluid to travel to the node.
They bring the intelligence in.
Exactly. Once there, they present this intelligence to the lymphocytes. The lymphocytes then undergo massive proliferation.
Which is why your lymph nodes swell up when you're sick. Right.
You got it.
Yeah.
And then they manufacture highly specific antibodies to hunt down that pathogen systemically.
Okay, so if we translate that biology to the reality of breast cancer treatment, the trauma becomes incredibly clear.
It's a massive disruption.
If you undergo an axillary lymph node dissection, the surgeon is physically cutting out those train stations from your armpit. They are severing the tracks.
And to be fair, the surgical intervention is often absolutely necessary to stage the cancer and determine if it has metastasized.
Right, it saves lives.
Yes. But the structural cost to the lymphatic network is profound. We are not just talking about a few missing nodes, we are talking about the disruption of a major regional drainage basin.
And what if they also do radiation?
That makes it much harder. If the treatment protocol includes regional radiation therapy, the tissue damage causes extensive fibrosis.
Meaning scarring, right?
Yeah, intense scarring. The radiation burns and scars the tissue bed, which can choke off and obliterate whatever collateral lymphatic vessels actually survive the surgery.
That's terrifying. And the clinical textbook points out that depending on the severity of the intervention, the rates of secondary lymphedema are just staggering.
The numbers are higher than most people
A
realize.
consensus indicates that for high-risk patients, those who require both comprehensive node removal and regional radiation, the risk of developing lymphedema can escalate to between 40 and 75%.
It is one of the most significant chronic morbidities associated with breast cancer survival.
Up to 75%, that's most people in that category.
It is, and the pathophysiology is a direct consequence of everything we just outlined about fluid dynamics. The arterial blood supply to the arm is perfectly intact.
The heart is still pumping blood down there.
Exactly. The hydrostatic pressure continues to push fluid out of the blood capillaries into the tissue spaces at a constant rate. That 10 to 15% of protein-rich fluid is continually being produced.
But the exit route is catastrophically blocked.
The drainage pipe is gone, but the faucet is still running.
Wow. That's the perfect way to put it. The faucet is still running.
Consequently, the interstitial fluid pressure rises, and the macromolecular waste begins to pool in the extracellular space of the arm.
Reading the patient accounts in these sources, the psychological whiplash is brutal.
It's heartbreaking.
You survive the cancer, you heal from the surgery, you finish the radiation, you might go years thinking you are completely in the clear. And then, seemingly out of nowhere, the swelling begins.
It's very jarring.
It serves as this chronic, daily physical reminder of the cancer. But why is there such a massive delay? Why doesn't the arm swell the day after surgery?
The delay speaks to the resilience of the human body. The lymphatic system is highly adaptive. It will attempt lymphangiogenesis.
Which means growing new vessels.
Yes, the sprouting of new vessels. It will also try to reroute the fluid across the watershed pathways of the torso to drain into the opposite armpit or down into the groin.
So the body tries to build detours.
Exactly. And for months or years, this compensatory mechanism might be just enough to keep the fluid from visibly accumulating.
But eventually it fails.
Yes, because this collateral system is fragile. Eventually, a minor infection, a sunburn, the natural aging of the tissue, or just the cumulative mechanical strain on those few remaining vessels tips the scale.
And that's when the detours collapse.
Right. The compensatory mechanisms fail, and the fluid begins to visibly accumulate.
So if you are sitting at home right now listening to this and you've had this surgery, you cannot wait for your arm to visibly double in size to take action.
Please don't wait.
The clinical texts are aggressively adamant about this. Early intervention is the only way to protect the architecture of your arm, and the warning signs are not necessarily visual at first, right?
No. Often you can't see them at all initially. There's subtle sensory changes.
Like what should people look out for?
You are monitoring for a sensation of heaviness or fatigue, specifically localized to that limb.
Just feeling heavy.
Yes. The arm might feel inexplicably tired after doing normal tasks. You might notice a sensation of tightness in the skin or a transient, minor increase in volume.
Like a watch feeling tighter.
Exactly. Your watch band leaves a deeper indentation or a ring becomes difficult to remove. And most critically, you might notice an increase in tissue consistency.
What does that mean, consistency?
When you palpate or squeeze the flesh of the affected arm compared to the healthy arm, it feels denser, firmer, less pliable.
Okay, so if you feel that heaviness or that dense tissue, call your doctor. Do not assume it is just post-surgical fatigue or normal aging.
Advocate for yourself immediately. Ask for a lymphatic screening.
Because the biological consequences of waiting are irreversible. I understand the fluid pools and causes swelling, But the sources discuss adipose hypertrophy?
The fat cells growing.
Yeah. Why does stagnant fluid make fat cells multiply? What is the biological connection there?
This is where we cross from a simple plumbing issue into a complex pathological cascade. When the protein-rich fluid stagnates in the tissue, it is recognized by the body as abnormal.
So the immune system freaks out.
Basically, the resident macrophages initiate a chronic inflammatory response, releasing a continuous stream of cytokines.
Those are the alarm bells.
Right. This inflammatory environment, combined with the fact that stagnant lymph is incredibly rich in lipids, fundamentally alters the local cellular metabolism.
Lipids meaning fats.
Yes. The high lipid content acts as a direct substrate, or food, and the inflammatory cytokines act as a trigger. This causes local pre-adipocytes to differentiate into mature adipocytes.
So the toxic fluid is literally feeding and triggering the fat cells to grow and multiply.
Yes, the stagnant fluid is adipogenic. It literally creates fat.
That's seeing.
And it gets worse. Those same inflammatory cytokines activate fibroblasts in the tissue.
What are fibroblasts?
Fibroblasts are the cells responsible for wound healing. They lay down collagen. In this chronic inflammatory state, they continuously deposit excess collagen throughout the extracellular matrix.
Which causes scarring?
This is fibrosis. The tissue becomes heavily scarred, rigid, and thick.
The arm is literally hardening from the inside out.
And once the arm fills with fibrotic scar tissue and hypertrophied fat cells, it is incredibly resistant to conservative treatment.
Because it's not just fluid anymore.
Exactly. You cannot simply squeeze away fat and scar tissue with a massage. The goal is to catch the lymphedema in stage 0 or stage 1 when it is primarily just an accumulation of fluid.
Before the adipogenesis and fibrosis have taken hold.
Precisely. That early window is crucial.
Which brings us to the clinical battlefield. You feel the heaviness, you advocate for yourself, you go to the clinic, and you are immediately introduced to compression therapy.
Oh, a standard of care.
But if the tissue is threatening to harden and the biological pumps are compromised, how does wrapping the arm in a tight elastic sleeve actually solve the cellular issue?
Compression therapy operates on the principles of Laplace's law.
Which is?
Because the internal smooth muscle contractions of the lymphangians and the overall tissue pressure are compromised, we must artificially recreate that pressure from the outside.
Oh, I see.
A specialized gradient elastic sleeve or multi-layered short-stretch bandaging exerts a highly calculated external force on the limb.
It's squeezing the fluid out.
It is increasing the interstitial hydrostatic pressure to a level that overcomes the oncotic pressure of the trapped proteins. It physically forces the stagnant fluid out of the extracellular spaces and back into the initial lymphatic capillaries that are still functioning.
Okay, so it pushes it back into the pipes.
Yes. Moreover, a compression garment provides a semi-rigid boundary.
Why does that matter?
When you flex your arm muscles inside a compression sleeve, the muscle cannot expand outward because the sleeve is holding it tight, so it is forced to expand inward, crushing against the deep lymphatic vessels.
Which massively amplifies the efficiency of your natural muscle pump.
Exactly. It turns your everyday movements into powerful lymphatic pumps.
But compression is rarely prescribed in isolation, right? Patients are routinely sent for MLD manual lymph drainage.
Yes, combined therapy is very common.
And to be clear, because the sources are very strict about this is not a deep tissue massage you get at a spa.
Absolutely not. In fact, a deep tissue massage can be dangerous for lymphedema.
Wait, really? Why?
Deep tissue massage increases local blood flow. That brings more fluid into the tissues, exacerbating the lymphedema.
Oh, that makes sense. It turns up the faucet.
Exactly. MLD is a highly specialized, superficial technique. The therapist applies precisely calibrated, directional skin stretching movements.
Just stretching the skin.
Yes, very gently. The goal is to mechanically mimic the rhythmic contraction of the lymphangians. They are physically stimulating the anchoring filaments to open those capillary doors.
And manually pushing the fluid across the body's watersheds toward healthy regional lymph nodes.
Right. Mechanically, combining compression and MLD makes perfect sense.
You manually push the fluid out of the arm with MLD, and you use the compression sleeve to keep it out.
It sounds foolproof.
It does.
Right.
But this is where the Swedish SBU alert report throws a massive curveball into the standard of care.
Yeah, that report is very eye-opening.
They conducted a rigorous health technology assessment of the actual clinical evidence for combining MLD with compression versus just using compression alone.
The SBU report is a fascinating exercise in evidence-based medicine. They stripped away the clinical assumptions and looked strictly at the randomized controlled trials.
The gold standard of medical research.
Exactly. They identified 3 specific RCTs that evaluated this combined therapy.
Let's break those down. What did the trials actually show?
Well, in 2 of the 3 trials, the addition of MLD to standard compression bandaging yielded a statistically significant reduction in edema volume.
Okay, so it worked.
Yes, and a noticeable improvement in subjective patient symptoms immediately following the intensive treatment phase. The patients experienced measurably better physical relief than those who only received compression.
But there is a massive caveat with the third trial, right?
Right. The third RCT showed no statistically significant difference between the 2 groups.
None at all.
None. The patients receiving MLD did no better than those wearing the bandages alone.
Now, clinically, we have to ask why. Why would 2 show it works and 1 show it doesn't?
It often comes down to study methodology and patient populations. Differences in the severity of the lymphedema at baseline. Variations in how strictly patients complied with wearing their compression garments at home. All of that matters.
Compliance is a big one, yeah.
And even the specific techniques used to measure limb volume can heavily skew the data in these smaller trials.
The report also looked at observational data, right? Large case studies.
They analyzed several case series involving over 400 patients altogether.
And what did those show?
These studies overwhelmingly demonstrated that combined therapy aggressively reduced limb volume.
Okay, that sounds like a win.
It does. However, because of the observational design, researchers could not scientifically isolate the variables.
Meaning they didn't know which part was doing the heavy lifting.
Exactly. They could not definitively prove how much of the volume reduction was attributable to the therapist's manual drainage versus the multi-layered bandaging that was applied immediately afterward.
So the ultimate conclusion of the SBU alert report is that the combination of MLD and compression receives a grade 3 rating.
Which means limited scientific evidence.
Right. Limited scientific evidence. They also point out the economic reality, which is huge for patients. A cycle of MLD costs thousands of Swedish kroner, translating to hundreds or thousands of dollars out of pocket, or placing a massive burden on healthcare systems.
It is not a cheap therapy.
And they explicitly state there is no proof of a permanent structural effect on the lymphatic architecture.
It doesn't rebuild the severed nodes.
So I have to ask, if it costs hundreds of dollars and it doesn't permanently fix the severed pipe, aren't we just prescribing patients an incredibly expensive temporary massage? Why even bother?
That is the exact debate happening in oncology rehabilitation right now. It's a hot topic.
I can imagine.
If the metric for success is a permanent structural cure, then MLD fails. It does not regrow lymph nodes.
Right.
However, we have to evaluate the patient's immediate lived experience. Chronic lymphedema is incredibly painful, heavy, and restrictive.
It ruins daily life.
Exactly. The immediate, profound physical relief of tension, the acute reduction in arm volume, the restoration of range of motion that holds immense clinical value for the patient's sanity and comfort.
It's about symptom management and quality of life.
Precisely. The clinical consensus shifts away from viewing MLD as a cure and instead frames it as a highly effective acute maintenance tool.
So you use it when things get really bad.
Yes. It is invaluable during the intensive decongestive phase to get the swelling under control initially or to manage severe flare-ups. But it's not a standalone fix. It must be integrated into a lifelong lifestyle of self-management.
And that transition to self-management requires us to look beyond the plumbing.
We have to look at the whole body.
Right, because clinical treatments like compression sleeves and MLD are fantastic for managing the physical accumulation of fluid in the arm. But they don't explain why patients with localized lymphedema often report profound systemic fatigue, brain fog, and a general feeling of chronic illness.
They just feel sick all the time.
Yeah. To understand that, we have to zoom into the cellular level and look at the biological trap of chronic inflammation.
We really need to completely reframe our understanding of inflammation here.
How so?
We are conditioned to view inflammation as a pathology, a bad thing. But it is actually a vital, highly orchestrated immune response. It is a biological necessity for survival.
But it's supposed to be temporary, right?
Exactly. It is strictly designed to be a two-phase operation.
The analogy that synthesizes this perfectly from the sources is thinking of inflammation like throwing a massive wild party to celebrate a victory.
Oh, well, this analogy.
Phase 1 is the attack. The immune system detects a pathogen or tissue damage, and it sends in the troops. The house gets completely trashed. There is debris everywhere. Walls are broken. Chaos ensues.
That is the acute inflammatory response destroying the threat.
Right. And then phase 2 is the cleanup,
Yes, and the cleanup phase is entirely dependent on the lymphatic system.
the cleanup crew.
It is the only mechanism capable of hauling away the apoptotic cells, the destroyed pathogens, and most importantly, the potent inflammatory cytokines that were utilized during the attack.
But in a patient with lymphedema, the cleaning crew never shows up. The pipe is blocked.
And this is where the biological trap snaps shut. Because the lymphatic transport fails, the inflammatory cytokines, those chemical messengers screaming for an immune attack, are trapped in the arm tissue.
So the party never ends.
The party never ends. The immune system is locked in a state of high alert, continually firing inflammatory signals into an environment that is already overwhelmed. This is chronic inflammation.
And that chronic signaling is what causes the structural damage we talked about earlier.
Exactly. We discussed how this triggers the fibroblast to lay down scar tissue, stiffening the extracellular matrix.
Right, the fibrosis.
But here is the most insidious part of the cycle. When that extracellular matrix becomes stiff and rigid from chronic inflammation, it physically suppresses the biological signals necessary for repair.
Wait, it stops the healing.
Yes, the cells that line the lymphatic vessels require a specific growth factor called VEGF-C to sprout new vessels and heal. Stiff fibrotic tissue actually downregulates the receptors for VEGF-C.
So let me get this straight. The stagnation causes the inflammation. The inflammation causes the tissue to stiffen with scar tissue, and that exact stiffness biologically prevents the lymphatic system from growing new vessels to fix the stagnation.
It is a self-perpetuating vicious cycle, a biological trap.
That is incredibly frustrating.
It is. And because those inflammatory cytokines are constantly simmering in the local tissue, they eventually leak into the systemic circulation.
Which explains the whole body fatigue and malaise that patients experience.
Exactly. The localized fire starts smoking out the whole house.
Understanding that your cells are trapped in this rigid, inflamed matrix can feel incredibly daunting.
It feels like a lost cause to a lot of patients initially.
But it's actually the key to taking control of your recovery. If the stiffness of your cellular environment is dictating the failure of your lymphatic system, how do we change that environment?
This is where Dr. Lamolle's work introduces a profound paradigm shift: epigenetics.
Epigenetics. This is huge.
For most of the 20th century, the prevailing scientific dogma was genetic determinism.
Meaning your genes are your destiny.
Right. You were a prisoner to your DNA.
Right.
If you were dealt a certain genetic hand, or if you suffered a traumatic surgical alteration, your physiological fate was sealed. The architecture was fixed.
But epigenetics proves that the architecture is highly responsive. The genome isn't a static blueprint, it's a massive switchboard.
Exactly. Epigenetics studies how environmental factors and lifestyle choices chemically modify the expression of your genes without altering the underlying DNA sequence.
So you still have the same genes, but they act differently.
Yes. We now know that specific dietary compounds, mechanical forces, and even neurochemical states act as epigenetic on-off switches.
You can consciously upregulate the genes responsible for producing anti-inflammatory proteins.
Yes, and you can suppress the genes driving that chronic inflammatory cascade.
So what stands out to you here? To me, it's the shift from being a passive patient receiving a compression bandage to an active participant regulating your own genetic expression.
It restores agency. That's the biggest psychological win here.
You are reclaiming autonomy over your cellular health.
When you understand that every meal, every movement, and every breath is a direct biochemical communication to your lymphatic endothelial cells, you are no longer a victim of a severed pipe.
You are actively engineering a cellular environment that promotes flow and reduces fibrosis.
It's a totally different mindset. It brings hope.
So let's translate this high-level epigenetic science into a practical daily roadmap.
Yes, let's get into the actionable stuff.
We want to outline the specific steps you can integrate into your day to actively flip those switches and build lymphatic resilience. We'll start with nutrition, which the sources categorize as feeding the flow.
Diet is the most immediate way to alter the viscosity of your interstitial fluid and influence your epigenetic switches.
And Dr. Lamolle emphatically points to the Mediterranean diet as the gold standard for lymphatic health, right?
He does. Consistently.
And this isn't about calorie counting to lose weight. It's about providing the right biochemical substrates.
Exactly. The focus is on a high intake of complex carbohydrates, lean proteins like fish, and a heavy reliance on healthy, unsaturated fats.
Like olive oil.
Yes, particularly extra virgin olive oil. The critical objective is to drastically reduce the intake of heavily processed foods, refined sugars, and saturated fats.
Why are those so bad for lymphatics specifically?
Clinical studies show that high-fat, highly processed meals dramatically increase the lipid load in the intestinal lymphatics. The lymphatic fluid physically becomes thicker, more viscous, and sluggish.
Like sludge in an engine.
Exactly. If your arm is already struggling to drain fluid, introducing a sludge-like viscosity systemically is disastrous.
You want to consume compounds that act as biological drain cleaners, breaking up the oxidative stress. And the absolute superstars in this regard are flavonoids and polyphenols.
They are essential. These are the diverse organic compounds that give fruits and vegetables their vibrant colors.
Eating the rainbow, basically.
Right. At the cellular level, flavonoids are incredibly potent. They have a well-documented protective effect on the delicate endothelial cells lining the blood and lymphatic vessels.
How do they actually do that? How does eating a handful of berries protect a vessel wall in your arm?
Flavonoids directly neutralize reactive oxygen species in the bloodstream. This severely blunts the oxidative stress that damages vessel walls.
I see.
More specifically, certain flavonoids like diasmin and hesperidin, which are heavily referenced in the clinical literature and often synthesized into supplements like Daflon, have profound pharmacological effects.
What'd it do?
They decrease capillary hyperpermeability.
Which means?
This means they stop the blood capillaries from excessively leaking fluid into the tissue in the first place.
So they turn down the faucet.
Exactly. Furthermore, they inhibit the adhesion of leukocytes, white blood cells, to the endothelial walls, preventing those cells from migrating into the tissue and releasing more inflammatory cytokines.
They are biologically silencing the inflammatory alarm. They tighten up the leaky blood vessels and calm down the white blood cells.
Yes. By flooding your system with these compounds, you are changing the biochemical environment of the extracellular matrix.
You are turning off the wild party.
Right, reducing the fibrotic stiffness and giving the surviving lymphatic vessels the optimal environment to function and dilate.
Okay, so you feed the flow with flavonoids. Next, we look at forcing the flow through mechanical movement. And the most mechanically fascinating recommendation across the holistic sources is the rebounder.
The mini trampoline?
Yeah. It seems overly simplistic, but the biomechanics of rebounding are uniquely tailored to the anatomy of the lymphatic system.
It's actually genius when you look at the physics.
Let's break down the G-force. When you jump up on a rebounder, you reach the apex of the bounce, and for a split second, you are weightless.
True weightlessness.
Then gravity pulls you down. As your body accelerates downward, the fluid in your vessels is pushed toward your feet. But the lymphangians have those bicuspid one-way valves.
Right, they only open upward.
When the fluid tries to rush backward down your swollen arm, the valves instantly snap shut, trapping the fluid in the higher segment.
That is the crucial mechanism. Then, when you hit the mat and rapidly decelerate, the physical force compresses the tissues, squeezing the vessels.
Like that muscle pump we talked about earlier.
Exactly. As you accelerate back upward against gravity, the fluid is propelled forcefully upward, the valves open, and the lymph shoots toward the major drainage ducts in the chest.
You are systematically exploiting gravity to artificially recreate the pumping action your arm lacks.
It's incredibly efficient.
Yeah.
The literature suggests that just a few minutes of rebounding can accelerate lymphatic flow up to 4 times the resting rate.
4 times! That's a massive mechanical advantage.
But for patients who cannot use a rebounder, maybe due to balance or joint issues, the sources emphasize specific yoga practices,
Which ones specifically?
particularly poses that compress the abdomen, like the bow pose.
The one where you lie on your stomach, grab your ankles, and rock back and forth?
Yes, that's the one. The deep abdominal cavity houses the cisterna chyli.
Cisterna chyli. What is that?
It's a massive lymphatic sac that collects fluid from the lower body and the highly active intestinal lymphatics. By physically rolling and compressing the abdomen, you are manually squeezing this deep reservoir.
Forcing a massive volume of lymph upward into the thoracic duct.
Right. Furthermore, yoga induces parasympathetic nervous system dominance.
It relaxes you.
It dramatically lowers cortisol and stress hormones.
Which is biologically essential, right? Because high levels of circulating stress hormones cause systemic vasoconstriction. The vessels clamp down tightly.
Yes, stress literally closes your pipes. By engaging in mindful, compressive movement, you lower those hormones, allowing the lymphatic vessels to mechanically dilate, drastically reducing the resistance to fluid flow out of the arm.
That makes total sense. And Donna Eden's energy medicine protocols integrate this mechanical manipulation as well.
Her approaches are very hands-on.
Yeah, her lymphatic flush involves vigorously massaging the side seams of the legs and the large intestine meridians.
It's an aggressive manual sweep.
Patients report that aggressively manually flushing these systemic pathways clears so much peripheral cellular debris that they experience a fasting high,
Like a surge of physical clarity and energy.
simply from unburdening the immune system's trash network.
Whether it is rebounding, abdominal compression in yoga, or manual flushing, the principle remains constant.
Yeah.
You are utilizing systemic mechanical force to overcome the localized failure of the lymphatic pumps.
This brings us to the final and perhaps most elegant pillar of the daily roadmap, opening the flow through breath and relaxation.
This is my favorite part.
It sounds totally counterintuitive that relaxing in a chair can physically drain fluid from your arm, but it comes down to the physics of the thoracic duct, doesn't it?
It does. The thoracic duct is the largest lymphatic vessel in the body, running straight up through the chest cavity.
And it drains everything.
It is responsible for draining the vast majority of the body's lymph back into the venous system at the subclavian vein. The flow of fluid through this massive pipe is heavily dependent on intrathoracic pressure.
When you take a deep, slow, diaphragmatic breath where your belly expands, rather than shallow, panicked chest breathing, you are expanding the volume of the chest cavity.
And Boyle's law dictates that as volume increases, pressure decreases. You are creating a state of negative pressure in the thorax.
That negative pressure is a biological vacuum.
Exactly. When you inhale deeply, that vacuum actively sucks the lymphatic fluid from the high-pressure periphery of your body, including the stagnant fluid in your swollen arm.
Pulling it rapidly up into the chest cavity to be dumped into the bloodstream.
Deep breathing is a mechanical necessity for draining your arm.
But it gets even more fascinating when we look at the biochemistry of relaxation. The holistic sources note that activities like humming, singing, and deep meditation don't just lower stress. They physically alter the vessel walls by increasing the production of nitric oxide.
Nitric oxide is amazing. It is one of the most potent endogenous vasodilators in the human body.
The endothelial cells lining your blood and lymphatic vessels produce it, right?
They do. When nitric oxide is released, it signals the smooth muscle layer surrounding the vessel to instantly relax. The vessel widens, the internal resistance drops, and the fluid flows with significantly less friction.
So humming a song while you drive or doing 5 minutes of deep diaphragmatic breathing isn't just about feeling mentally calm.
No, it is a targeted epigenetic intervention.
You are biologically forcing your lymphatic vessels to dilate and vacuum the toxic fluid out of your fibrotic tissue.
If we connect this to the bigger picture, reducing stress isn't just about feeling mentally calm. It's a mechanical requirement for your vessels to open up and allow the fluid to escape your swollen arm.
It perfectly bridges the perceived gap between mental well-being and physical pathology. The state of your nervous system dictates the physical diameter of your drainage pipe.
You simply cannot separate the mind's stress state from the lymphatic system's physical capacity to heal.
When we step back and look at the entire patient journey we've mapped out today, the narrative arc is incredibly empowering.
It really is a journey from fear to control.
We started with the very real physical trauma of an axillary node dissection and the anxiety of those subtle early warning signs, the heaviness, the increased tissue density.
And we navigated the harsh clinical reality of compressive forces and the nuanced immediate relief benefits of manual lymph drainage.
And we translated all of that clinical data into a proactive daily lifestyle.
The epigenetic roadmap.
Exactly. You learn how the flavonoids in your diet biologically repair your vessel walls. You understand how the mechanical G-force of a rebounder forces your one-way valves to clear the fluid.
You realize that a deep breath is a literal vacuum pulling waste from your arm.
You are no longer defined by a blocked pipe. You are the active manager of a highly responsive epigenetic river of health.
You are reclaiming total control over your cellular environment, ensuring that the inflammatory party ends and the cleanup crew arrives every single day.
And as we wrap up this deep dive, there is one final awe-inspiring concept from Dr. Lamolle's research to consider as you incorporate these habits into your life.
Oh, the brain connection. This is fascinating.
We have spent this entire time focused on optimizing lymphatic flow to manage the swelling in an arm and to protect cardiovascular health.
Yeah.
But the implications of a healthy lymphatic system go far beyond the limbs.
So much further. Modern neuroscience has recently uncovered the existence of the glymphatic system.
For decades, it was textbook dogma that the brain lacked lymphatic vessels entirely.
Right, they thought the brain was completely separate. We now know that is completely false. The brain possesses a highly specialized macroscopic waste clearance system.
And it is tied entirely to our sleep
Mm.
cycles.
Yes. During deep sleep, the glial cells in the brain actually shrink by up to 60%.
Wait, they physically shrink.
They do. This massive structural change allows cerebrospinal fluid to rush through the brain tissue, aggressively washing away the metabolic waste and neurotoxins that accumulated during waking hours.
It is a literal brainwashing.
It is. And the specific toxins it clears out include amyloid beta proteins.
Aren't those the exact plaques associated with the pathogenesis of Alzheimer's disease and long-term cognitive
The
decline?
very same.
So if you are sitting down to a Mediterranean meal rich in flavonoids, or taking 10 deep diaphragmatic breaths, or doing a lymphatic flush to manage the secondary lymphedema in your arm, you are not just treating your arm.
You are treating your entire body.
By systematically lowering chronic inflammation and optimizing your entire biological transport network today, you are actively participating in the deep cleaning of your own mind. You are protecting your cognitive longevity.
The secret river connects everything. By managing the microenvironment of your arm, you're preserving the macroenvironment of your brain.
It is a complete system of resilience. So take a deep breath, embrace your body's incredible capacity to adapt, and keep that river flowing. Thanks for joining us on this deep dive.